So finally, Risdiplam uh, data presented at the Cure SMA that was novel included data on the RAINBOWFISH study as well as in the JEWELFISH study. So let's start with the RAINBOWFISH. The RAINBOWFISH is the pre-symptomatic study with Risdiplam that includes children under a certain age, I think it's 6 weeks, who have to be pre-symptomatic. And it is still enrolling patients, so this was very preliminary data. And what it found is that in the few patients that had been treated, that they had a favorable outcome and that there were no significant side effects. The data is still being collected, and final analysis will have to uh, wait until that final data comes out, but it looked very promising as an alternative for pre-symptomatic patients. The second new presentation was the Jewelfish study, which is a study that I am very familiar with. And I presented during the meeting. And this is a large study. There are 174 patients in the study. The uniqueness of the jewelfish study is that it includes non naive patients. These are patients who have been treated with disease modifying therapies, and that includes two molecules that are no longer under study, which is the RG 7800, the old moonfish study, and the alexisime study, which is also not being pursued further. And then there's a substantial group of patients previously treated with nusinersen, as well as a smaller group of patients previously treated with onasemnogene apoparvovec, both intravenous and intrathecal. And that's the smaller of the group, and the more recently who have been followed. It was mostly a safety and tolerability study to show that prior treatment with these medications was safe and that risdiplam can be added or followed without any undue safety concerns. So it's primarily a safety and tolerability study. So with the focus on that, what was found is that there were no serious adverse events that were related to the medication, risdiplam, and that there were no withdrawal of medication due to side effects to risdiplam. And that's the take home message. And when you look at the onasemnogene apoparvovec treated children, they had the same safety profile as did the entire cohort. So overall, nothing related to the medication. Certainly none of the preclinical findings that had been reported were found in any patient. With regards to the AEs that were noted, these were mostly related to the underlying disease, SMA, and mostly respiratory issues were the most serious ones. We also did an efficacy assessment as a um, exploratory assessment. Exploratory because it's not the primary reason for the study, because these were patients who ordinarily would be excluded from a clinical trial. They were very advanced disease, with the majority of patients, except in the onasemnogene, having a Hammersmith uh, functional motor scale extended of less than 10, who had scoliosis, and a lot of them had severe scoliosis. So that impacts any study that shows improvement, because when they're end stage, it's less likely to be seen, and that's across the board. So, in with all of that in mind, we did find on the MFM32, which is the primary outcome measure that was used in the sunfish, and that shows over time more sensitivity to change, especially in these older groups, and has been found to decline over time in this population. So the fact that the study found stabilization of outcome, I thought that was an important finding, that despite the heterogeneity, the severity of the population, there was no progression of disease. We're going to continue the study until 24 months, and we'll have a complete analysis of all the data sets. We did not do subset analysis in this group, and just to note that children under 2 who are in the gene transfer therapy would not be included in this analysis, because children under age 2 can't participate in the MFM32. So those were the two related to risdiplam. The RAINBOWFISH, which data will help confirm its utility and safety in the under 2 month population, and then the safety and tolerability from prior treatments that was found to be safe and quite tolerated in this population. Importantly, only 5% of the patients withdrew from the study over time, which is a very small proportion, and none of the patients in the gene transfer therapy withdrew from the study. The management of patients who have a decline in function or a perceived lack of efficacy is often something that clinicians are faced with. And for many of the patients who were in the nusinersen group, that was one of the main reasons, aside from access. So, for those patients who had tolerability concerns about the intrathecal injection or who had perception that there was a lack or loss of efficacy, this switch over to Risdiplam would be a viable option, as was noted here that there was at least stability, that patients would keep whatever benefit they might have had and certainly not show further decline. So I think it adds the possibility as a viable alternative when nusinersen is considered not to be the best agent in the eyes of the patient or of the clinician to switch over. With regards to risdiplam in the pre-symptomatic, we have to wait for the data to be accrued, but it does appear to be safe and tolerable, and some efficacy was seen, so it may be an option in the future to be considered for that newborn screening patient who is interested in treatment and may not be interested in the other two agents that are currently in use, either because biological side effects are of concern or access and the procedure of intrathecal injection may be of concern to the parents. But that's still in the future because that study has not been completed or approved for use under 2 months of age.